Hello, welcome to our look ahead at what the papers will be bringing us in the next few hours. Joining me to take a look at the front pages, the Whitehall Correspondant for the FT, the Financial Times, Sebastian Payne, and the Chief Leader Writer for the Observer, Sonia Sodha. Let's just flick through those front pages. The Times, leading with comments from England's Chief Medical Officer at the daily press briefing today from Downing Street. He says he believes that the number of new cases of coronavirus reported is beginning to flatten out. 761 deaths reported today. The heartbreaking news of the death of a pregnant nurse leads the front page for the Metro. Doctors managing to save her baby, who was delivered by C-section and said to be doing well. The Health Secretary Matt Hancock comes under fire in the Daily Mirror as he is criticised for offering care workers a badge of honour, with the GMB union telling the paper they need more than just a badge. Fears from paramedics that more people are dying at home because they are reluctant to call for an ambulance. That is according to The Guardian. The Telegraph reporting that ministers will make a decision on how long an extension to lockdown measures should last during a COBRA meeting coming up in the next 8 hours or so, 9 hours. And The Express celebrating the achievements of 99-year-old Captain Tom Moore, who has raised, goodness, almost £10 million, about $12 million for the NHS by doing laps of his garden. Let's start again. Good to speak to you both again. Sorry to interrupt that with President Trump's briefing, but right, Sonia, let's start with the Times and reaching the peak, if not the peak itself. What did you make of that briefing today from Number 10?
Well, so I thought the experts, the Chief Medical Officer for England, Sir Chris Whitty, was quite cautious, actually. So the good news from over the weekend is that even though people are still dying in every death is a tragedy, that number has appeared to level off at about 800 deaths a day over the bank holiday weekend. There are a couple of caveats to that, though. One is that, as Whitty said at the press conference today, there may be a bit of a lag in reporting of deaths over the bank holiday weekend. So it's too early to say for sure that the UK has reached its peak. The other big caveat, I think, is that in England, care home deaths, which we know are significant, are not being reported in the official daily figures that we're getting. And on the front page of The Guardian today, there's a news story that we're seeing an increase in the number of people who are dying at home. And again, those are not captured in official figures at the moment. So there are some caveats. The good news, however, is that it does appear that infection rates may be levelling off. It suggests that social distancing is working. At the press conference, the government was very, very cautious about speaking yet about exactly what the strategy is for relaxing social distancing. They say that's too early to do so yet, but we can apparently expect to hear more about that in the coming days.
Sebastian, good news, it seems, certainly on the horizon. The government saying it'll listen to medical advice before the lockdown is lifted. Dominic Raab expected to say it's going to be another 3 weeks. Interesting in terms of the figures about the number of intensive care beds that were still available. Does it seem, one doesn't want to tempt fate, that we have dodged the worst case scenario?
I think that was the general feeling from the press conference today, that we've never really been exactly sure when the UK would reach the peak of its coronavirus outbreak. There was some talk about the Easter weekend, others saying it could be as far away as May. But the words from Professor Chris Whitty, who's England's chief medical officer, suggested we are nearing, if not quite at the peak so far. And the whole aim of the government strategy has been to keep demand on the NHS for intensive intensive care beds below the capacity of the NHS. And we've had obviously some horrific stories in the papers from individual incidents, and a couple of hospitals have declared some major incidents. But generally, the UK's health service has held up throughout this crisis, and there's obviously the government has struggled on testing, on PPE equipment, but generally the speed and ability to which the health service has coped to produce these new ICU beds is quite astounding. And we've seen these pop-up Nightingale hospitals across significant parts of the UK, and there's a lot of reports around in the past couple of days they haven't been fully needed. Now, of course, we should caveat all this that we are not at the peak yet. It could still increase, and there could still be significant more demand on the health service. But when this crisis began, ministers were very concerned about a total collapse within the health service, with doctors, nurses, hospitals, GPs all being overwhelmed. So far, that's not the story of this. The story seems to be that the health service is coping, but there are still significant deficiencies on some of those areas of care provision which are elsewhere across the paper. So tomorrow, on Thursday, the government will formally make that decision to extend the lockdown for another 3 weeks. That would take us into May. It's all but a given that's what they're going to announce, although they haven't formally made that decision. But when we get to that next date, which will be the first week of May, I think the government is probably going to have to, at that point, set out its timetable for leaving the lockdown. So we're seeing from a lot of other European countries their basis for leaving the lockdown, and I think the government is very aware that the British people have been very effective at following and adhering to those measures, but patience will eventually run out, and particularly if we're past the peak and it feels as if we're over the worst of it, people will want to get back to work, get schools going and get going again. It's a very difficult decision for the government in 3 weeks' time, if not tomorrow.
Yeah, and it might be affecting different generations at different times. The care homes was the focus today in that press briefing with Matt Hancock, but both the Times and the Metro putting a picture of a very young victim, Mary Agyapong, a nurse who died on Sunday at Luton and Dunstable Hospital. Really, Sonia, just showing that this virus, when we thought it was going to affect the elderly with underlying health conditions, but it can still strike for such young people and pregnant as well, and still working in the NHS.
Yeah, this is just such a devastating story, I think, of a 28-year-old nurse who was heavily pregnant, came down with COVID symptoms, tested positive for COVID-19 a few days ago. She was able to give birth to her daughter through an emergency caesarean, but very sadly has just passed away. And that's going to be a little baby daughter growing up without her mum, an NHS nurse. It's just so devastatingly sad, I think. I think it will also raise concerns, as you hinted at, pregnant women are incredibly anxious, I think, at the moment. The government guidance at the moment is that until 28 weeks of pregnancy, they don't need to be shielding, but after that, they shouldn't be at work, for example. There are organisations that represent pregnant women who say that, women are being there's pressure being heaped on women who are pregnant to work. It's sort of being very much made to feel like it's a decision for individual women, and they don't necessarily feel protected. So I think the fact that, a 28-year-old with no pre-existing health conditions who was heavily pregnant has lost her life to COVID-19 will be really worrying to pregnant women up and down the country.
Well, I don't think it's clear yet, is it, how she contracted the virus? I don't think it seems that she contracted it through her work. It might have come from outside the hospital. But your point is valid, though, isn't it? That she's still working and heavily pregnant. Sebastian, onto the Mirror. Listen to Matt Hancock today. Lots of warm words for the care home sector. A lot of care home sector workers, of course, paid very little minimum wage, often feel they don't get the recognition they deserve. This offer of a badge, well, it doesn't cut much ice with the Mirror, does it?
No, it doesn't. And Matt Hancock, the UK Health Secretary, was leading that briefing today. And as you said, a lot of focus on care homes, which is where the government is really struggling, and those the care workers there don't feel as if they've got enough support from the government in terms of testing. The government rapidly acted to announce it would make sure tests could get to those care homes for the staff working there to make sure they can look after the elderly patients. But there's also just been this constant battle about personal protective equipment, the PPE equipment, that the government hasn't really got it quickly enough to the place it needs to go. And in response to that today, the Health Secretary was saying how much the government values care workers, to the extent that they've even got a badge that says care to go on the lapel, much like NHS workers have similar badges. I sort of get with what Mr. Hancock was doing, that he was trying to express how much the government does care about care workers, and it is doing everything possible in terms of equipment and testing. But when you see these tragic stories like the one we were just talking about, the ever-rising death toll from care homes, it struck a slightly flippant note, as if they weren't really taking the situation 100% seriously and really acting on what those care homes need. So it was good intentions from Matt Hancock, but I think generally people in care homes would much less have a badge and much rather have the PPE equipment they need to stay safe and look after the patients, and the tests for the staff and patients who are
we're way behind. We're way behind, aren't we, in terms of the daily number of tests? They pledged 100,000, but we're not even up to the 25,000 figure at the midway through April. Sonia, The Guardian, your sister paper, warning as virus leads to surge in home deaths, more people dying at home because they're reluctant to call for an ambulance. There have been several appeals, haven't there, by medics outside the coronavirus pandemic field, saying, look, if you are experiencing chest pains or whatever, for goodness sake, do come to hospital, because we can actually cure you or treat you there if you come in time, rather than leaving it too late.
Yes, that's right. And what this story reveals is that there are dozens more deaths than usual every day at this point in time due to cardiac arrest. Now, some of those may be coronavirus related. Some will be people who perhaps don't have symptoms of coronavirus, but are either worried about contracting COVID-19 if they go into hospital, or they don't want to be a burden on the NHS. And so it's likely that some are coronavirus related, some aren't, but these aren't deaths if they are coronavirus related that are getting added onto the daily death toll. And, it also illustrates that there are people with who need urgent cancer treatment. That's been cancelled because a lot of stuff has been put on hold. People are waiting longer to go in. So there will be deaths that are caused indirectly by this pandemic as well as directly. So I think it's a really important story from that perspective, and it really highlights the fact that the official death toll we've got is around sort of 12,000 deaths. That's a shocking, terrible number in of itself. Yeah. But by the end of this pandemic, there will be many more deaths, both from coronavirus that aren't included in that toll, but also people dying of other causes who weren't able to get treatment as quickly as they would have otherwise done in the NHS.
OK. The other story in The Guardian actually was Amazon raking in pandemic bonanza. Extraordinary figures there, Sebastian. $11,000 being spent a second on Amazon products. Jeff Bezos increasing his personal wealth by with a fortune of $138 billion. Let's go back, though, if I may, Sebastian, or let's go on to the Telegraph, rather, because care homes saying they cannot take patients from hospitals. Now, why is that? Because of the risk of infection?
Yes, very much so, that because the testing and lack of equipment in care homes has been so far behind what's going on elsewhere in the health service, the Telegraph reports tomorrow. Again, the key thing the government is trying to get to here is to cut off transmission of coronavirus from one place to another. And hospitals are so carefully controlling what they can and can't do with patients who have got coronavirus. This is clearly a real issue here. And one thing we did hear from Matt Hancock today, again at that press conference, was that those who have elderly relatives who are dying of coronavirus in care homes will be able to visit them, whereas those in hospital will not be able to visit them as well. So it's for those, there's been the stories of absolutely tragic family situations of people young and old who are passing away from this virus, who are not able to see and speak to their families. But at least for those elderly patients in care homes, there is a little bit of respite, I guess, in that. But clearly, the care home saga, I think, is going to be one of those things that will bite back on the government in this crisis.
Yeah, and Sonia, just interesting, the national records of Scotland statistics showing 237 out of 962 fatalities. If that was extrapolated and put into the UK figures, that would suggest, 4,000 care home residents have so far died from the virus. I mean, this really is the hidden story, isn't it? It seems to be emerging.
It's huge. And if you speak to some of the large care home chains, they are reporting deaths in the hundreds. One large care home provider has said it thinks that about half its care home settings have got COVID-19. And then the other thing that I think we mustn't forget about is that you've got the care home sector, but you've also got, thousands of older people being looked after in their own homes by professional carers, and some of those older people may be very sadly passing away at home, and they won't be counted in the official statistics yet either. So it's absolutely it is huge, and it's really, really important. And I know that care workers feel like they're very much they're playing sort of second fiddle, as it were, to the NHS in terms of access to personal protective equipment, in terms of access to testing. And care home managers are facing terrible dilemmas at the moment. They're being asked by government to take people who are being discharged from hospital, but who may have COVID-19 symptoms. A care home wants to help the local hospital out, but they also don't want to put up the residents who are already there at risk. There isn't official guidance from the government. So really tough ethical challenges that care homes are facing without much guidance from government.
Sebastian, a good news story on the Express in the midst of all this horror, really. Britain salutes our £10 million, that's $12 million, NHS hero. This is just amazing, isn't it? I mean, it only began on April the 9th.
Indeed, and the crisis bring out the best and worst in some people. I think we saw the worst in the country when everybody was rushing off to supermarkets and stockpiling ridiculously. But we've seen some of the best in the charity and voluntary actions that we've seen over the past couple of weeks, all of which have been surpassed by Captain Tom Moore, who, as we've heard over the past couple of days, served during the Second World War and is 100 very shortly, and from his care home in Bedfordshire has been doing laps of his garden to raise money for the NHS. It began at £100, went up to £1,000, and it's now reached £10 million. This 99-year-old with his little walker and walker seat is going backwards and forwards in doing it in laps of 10, I think laps of 100, I think, to try and get there, because
and just a brief final comment from you, Sonia. A lot of very small donations as well. It really has captured the national spirit, hasn't it?
Totally.
Yeah, and it's an incredible story, and huge kudos to this World War II veteran for doing it. But at the end of the day, we actually shouldn't want an NHS that relies on charity. We know the NHS has been facing its tightest funding settlement over the last decade. It has been underfunded, and that has left it without excess capacity, which meant that the government has had to work really hard to increase it. So you can't have a resilient health service if you are operating at or beyond capacity.
No,
so
but salute to Captain Tom. That is shared by all of us. Sonia and Sebastian, thank you both very much indeed for taking us through some of the first editions of the papers. That is it for our look at the papers. It is time now, though, for all the day's sports news.